Georgina with the Association of British Paediatric Nurses, and today I'm going to be talking to a children's nurse. We're going to talk all about their life and their experiences of being a children's nurse. I hope you enjoy the video.
Hello, welcome. I'm here today interviewing Becky Platt. I'm Georgina with the Association of British Paediatric Nurses, and welcome.
Thank you very much.
So are you currently a children's nurse or do you work in another field?
I am currently a children's nurse. I'm actually working in an advanced clinical practitioner role in paediatric A&E, but still very much a children's nurse and using lots of my nursing skills as well as my advanced skills as well.
And how long have you been a qualified children's nurse for?
Well, I actually qualified in 1996, so I've been a children's nurse for a very long time, and I've worked in a variety of different roles since then, pretty much all acute, and most of my career has been in A&E in one form or another. But yes, I've been a practicing children's nurse for the whole of that time.
So why children's nursing specifically? What drew you in?
I think the particular thing about children's nursing for me is that you've got the ability to be there in the moments that really shape children's lives. So you can make a difference literally from the moment of birth as a children's nurse, right through their formative years. And yeah, we as nurses, we are there in the moments that change people's lives, and we have the potential to really make a difference in those formative developmental years, and I love that about it.
Yeah. And what did children's nursing training look like for you?
So I trained in Oxford, at Oxford Brookes University. I did a 4-year course, so it was a degree course, and yeah, I spent, I think, gosh, it was a long time ago, wasn't it? I think there was quite a lot of lectures right at the beginning, and then we were, juggling lectures and placements. I think back in the day, we tended to have part of the week in lectures and part of the week on the wards, which is kind of, I think people tend to have more of a block of lectures and a block of placement now, but we were kind of juggling the two. So that was challenging at times, but I loved it. I got the opportunity to do loads of different placements, and to find out which bits of it really appealed to me.
Yeah.
I was mentored by some fantastic people at the time who were influential on me and how I developed as a nurse and the kind of things that I wanted to do.
And how does your current role compare to your role when you were a children's nurse?
So when I very first qualified, I worked on a children's surgical and neonatal ward at the John Radcliffe in Oxford. And I needed to use lots of acute skills then. But we also had some patients that were with us for quite a long time, so there was a lot of relationship building over time, as well as some kids who just came in and out very acutely. You might just know them sometimes for a few hours and sometimes for a few days. Now I work in A&E, so we should only see people for maximum of 4 hours. That doesn't always quite happen, but one of the things that I really enjoy about my role now is that I'm building relationships in a very short space of time with patients and families, and making some sort of bond with them in the moment that allows me to give the best possible care. And in my role now, so I'm working, I am still a nurse, but I'm working on the medical rota at the moment. So I see, treat and diagnose patients as part of the medical rota. So I often have more of a kind of diagnostic role, often more of a leadership role, but I still use my nursing skills to do that. And I think that one of the things that we are particularly good at as nurses is seeing the whole patient, as you know, as a whole person in the context of a family. And so, as well as my kind of clinical diagnostic skills, you know, I still feel very much grounded in that nursing model.
Yeah, that's lovely. And what's been your favourite part of being a children's nurse?
I think there's a lot of fun in being a children's nurse. I often find, you know, if I tell people what I do, they say, oh no, that must be really sad and that must be really stressful. And it is that. It absolutely is that. There are devastating moments, as we know, but there are also great moments of light and humour. So, you know, in my role, I can go from being in resus and managing a teenager, and then later on in the shift, I can be taking a piece of popcorn out of somebody's ear. And I love that variety.
Yeah.
I think we're very lucky to have that level of variety in our jobs.
What's the best experience you've had as a children's nurse? Do you have something that really stands out in your mind?
I think knowing that I've made a difference is the thing that really matters. So that might be meeting a family in the middle of the night with their 3-day-old, and they are absolutely end of their tether. They don't know whether they're coming or going. They, you know, don't know which end to put a bottle in and which end the poo comes out. And it's all very stressful. And I love spending time with those families at 3 o'clock in the morning and helping to calm everything down and helping them to recognise that this is normal, they're doing a good job, and all of the things that they're feeling is normal. Equally, you know, I love being in resus, dealing with life and death moments, and remembering actually that it's not just about dealing with the, you know, the medical side of things and saving their lives. It's also about recognizing that these people are humans, that they come with their own backstory and a whole set of experiences before we met them that matter, and understanding a bit about them and connecting with them on a human level. So I think, you know, it's the variety, and honestly it's the people that make a difference for me. That's
lovely. And what did a typical day as a children's nurse look like for you?
I suppose it's been different things in different areas of my career. So when I first qualified, I worked on a ward, so it might have been looking after a group of unwell surgical neonates. A lot of that was measuring feeds, measuring input and output, you know, literally sometimes measuring poo and all of that kind of stuff.
Not always glamorous.
I mean, a lot of it isn't glamorous, is it? But you just get on with it because that's what's required.
Yeah.
And you know, also, you know, developing relationships with people over time. Often, you know, later on in my career, I spent quite a number of years as the matron for children's services. At that time, there was a lot of supporting other staff to be the best that they could be, trying to help to navigate, you know, difficult situations and politics. Really enjoyed that side of things. I suppose I've had other experiences, you know, when I've done humanitarian work. So been out to refugee camp to manage diphtheria, been out to Samoa for the measles outbreak. You know, all of those things have very different workflows and experiences, but I suppose that the thing that they all have in common is that there's a huge amount of teamwork and relationship building, and you know, connecting with people, and that's the bit that keeps me interested. That's why I'm still in this job a quarter of a century later.
It's amazing that you've had varied experiences. Can you tell me a bit about your humanitarian work?
Yeah, so I was fortunate to be part of the UK emergency medical team. So we deployed. The premise of the UK EMT is that they take staff from the NHS who've got relevant experience and deploy them for a short time in humanitarian context. So that might be disasters, or so it could be earthquakes and things like that, or more commonly for me, it's been during disease outbreaks. So the idea is that they've got a team of people ready to go at very short notice, who can respond to crises. So, for example, in Bangladesh, there was a diphtheria outbreak in the Kuti Palong refugee camp. There'd been a huge influx of refugees, Rohingya from Myanmar, and they were largely, you know, unvaccinated population because of various political issues around that. So not only had they made this horrendous journey from home to this, what was then and possibly still is one of the biggest refugee camps in the world, then there was this diphtheria outbreak. So we were deployed to set up diphtheria treatment centres, and specifically to administer diphtheria antitoxin. So we had to develop procedures and protocols around that. We worked really closely with the national staff to make sure that we were building skills and capacity in the local healthcare community. We were lucky enough to work in these purpose-built diphtheria treatment centres, which were made out of bamboo. So it's just the most phenomenal place to work. And again, you know, working closely with people that we didn't know, forming those kind of team working relationships really quickly. Also working across language barriers, trying to learn a few words to help smooth things along the way, and working with translators, and you know, all of those things make you realise what's actually really important in life, in work, and actually, I think all of that has made me a better clinician back at home in the NHS.
Yeah.
So, yeah, I mean, it's been a phenomenal experience.
Yeah, it sounds like it must have also been incredibly hard, knowing they've gone through all this hardship to then have this outbreak. It must have been immensely stressful for you as well, trying to handle that.
I think it's, you know, some of this just doesn't feel fair, does it? But actually, you know, people have had a very difficult life, that they've been forced, you know, because of political situation, to flee home. That they often haven't been able to bring their whole family with them. And you know, we met many families where, you know, some family members were in the refugee camp and some were completely displaced and their whereabouts unknown. So it is stressful knowing that, you know, people have gone through that and then have succumbed to you know, a disease that is entirely vaccine preventable. And I suppose that's the other side of it. You recognise that, you know, how lucky we are that we've got ready access to vaccines, that we are on the whole preventing significant disease outbreaks like this. And there are still some pockets of humans in the world who don't have access to that level of healthcare. So I suppose that there's this kind of lack of fairness that's the hard bit to deal with there.
Yeah, definitely. And do you have a personal mantra or philosophy at all?
I like to think about treating patients and families the way that I would want people that I love to be treated. I want to try and remember that people are humans and to connect with them on that level. And I also feel passionate about being part of a team, supporting each other to be the best that we can be. I suppose just being kind to each other.
I think that's a lovely way to live life, yeah. And what qualities do you think every children's nurse should have?
I think you need to have a good understanding of why you're in it. You've got to be passionate about caring for people. You can't be afraid of hard work. It's useful to be, somebody who's good at managing your own time and being organised. It's also critical to have a way of looking after yourself. And I think that I suppose one of the things that's got me through difficult times in the long career is knowing who I can turn to for which bits. So often that's my family, but there's also a significant group of other people who are involved in my professional life that I can go to for advice, guidance, support, debrief, download, all of the things that actually enable you to make sense of things that are happening and to keep yourself safe, I think.
Yeah. And how do you unwind after a difficult day? What do you do?
I quite like running. I'm definitely not fast, but I do like running. I like seeing the countryside. I like to be outside and to spend some time doing that. I like a bit of yoga. I like to spend time with my family and friends, like good food. I think it's sometimes there needs to be some balance between spending time with people that absolutely understand what you do at work and who you can share some of that with, versus people who absolutely don't understand, and so you're able to talk about other things, and have a life outside of nursing. I think it's really important to have both bits.
Yeah, you need that mix, don't you? It can't all be about the job.
No, absolutely not. And I think there are, inevitably there will be some people who, think, they want to hear all about it, and they, so tell me about what's the worst day, what's the worst thing that's ever happened to you. Well, I can guarantee that the people outside of healthcare who ask me that question could not tolerate the answer if I told them it.
Yeah.
So that needs, that's the time to bring out, slightly sanitized versions of the truth.
Yeah.
But it's important to also have the other people who can take the truth when the truth needs to come out. So, I think that's where the balance comes in.
And if you could give advice to somebody wanting to become a children's nurse, what would you say to them?
Really examine why you want to go into children's nursing. Think about what it means to you and what you're expecting to get out of it, and how much you're willing to put in. Apart from anything else, recognise that people don't only get sick between 9 and 5 Monday to Friday. Much as that would be lovely. You're not going to be necessarily there for every social engagement that you would like to be there for. So that you have to recognise that that's part of the job. But also recognise that there are, in my opinion, very few other careers that could be as rewarding as this, where you can genuinely see that you're making a difference every single day. And sometimes that difference is a tiny thing, and sometimes you've literally changed the course of somebody's life. So if that's what you want, this is the career for you, then be prepared to work hard for it, to recognise that it's always not necessarily going to be easy, and to have a strategy for looking after yourself and making sure that you can make this sustainable for you.
Yeah. And what are some of the biggest challenges that you face as a children's nurse?
I suppose that the challenges have probably changed a bit over the course of my career, largely because of the way that I feel and my ability to make sense of things. I suppose I used to feel, sometimes out of my depth. At the beginning of my career, there were certainly clinical situations that I would find very difficult. I've got better at putting things down and not losing sleep over them, but there are still some things that stay with me longer than I'd like them to. I suppose these days, things that are particularly challenging are, things that are probably related to wider politics. So, I see huge numbers of young people coming in with very significant mental illness, and the services are not there to care for them. It's just a fact that, if you're a young person with a mental illness, life is going to be very challenging for you. And I think, as a society, we're going to have to do something about that. Equally, we see, in particularly where I work and, in other pockets around the country, young people who are victims of violence and affected by violence. We're going to have to find a way as a society to protect our young people better, because otherwise, we're going to see this mushrooming even further out of control. So I suppose so there are challenges around individual cases and things that feel very stressful, and maybe where I feel like I haven't been able to make the difference that I wanted to make. And then there are wider things around, bigger picture and the politics where, I can't, necessarily control that, where people like me can have a voice on the national stage about that, but other people need to step up and actually do something about it.
Yeah. And looking to the future of children's nursing, we've obviously just talked about mental health issues and protecting children. What do you think is important for the future?
I think we need things to be joined up. We need to recognise that it's not all about health, making a difference on health outcomes for children. We're going to need to support vulnerable families better. We need to recognise that children living in poverty even in 2023, we have children living in poverty who have significantly worse outcomes than other children their age who are living in more affluent circumstances. Yeah. There are still pockets of, you know, geographical areas in the country where health outcomes are worse, whether that's related to, you know, poor housing. You know, for example, where I work, we see a lot of children living in poor housing with mold and, you know, things like pollution that are negatively affecting health outcomes. We have to have some education around that. We've got to join up things like school and health to make sure that kids are getting nutrition that improves their health outcomes. So that's, you know, all before we even see them in hospital. And then we have to make sure that we've got enough beds for, particularly for cases like, you know, young people with mental illness, or community support, early access to help, all of those kind of things. And we're going to have to address the way that we pay for and value healthcare professionals, because people are leaving in droves, and we're going to have to address that if we want to keep people in this career that is incredibly rewarding, but is not ever going to make you a millionaire. So whilst I didn't come into nursing to be a millionaire, I am also aware that there are significant numbers of my particularly more junior colleagues who are using food banks and not able to stay in nursing because they literally can't afford to. We're going to have to change that.
Yeah, definitely. And what do you do, or did you do before, to put children at ease when you saw them?
I still do. I mean, I think I try to, I spend most of my time is clinical. So I try to find things to connect with them about. So, you know, it might, for a 3-year-old, it might be complimenting them on their beautiful sequined trainers and having a chat about that. It might be with a teenager, it might be trying to connect with them about music. It's often things like, you know, trying to find something that, you know, that you both know about and having a conversation about it. So it might be, you know, knowing about Paw Patrol and Coco Melon. It's actually really important to know that. I think building on that, there's also a lot about building trust. So one of the things that I think, you know, I feel passionate about is not lying to children. So we've got to recognise that they need to know the truth, that most children can actually cope with knowing the truth about hospital and procedures, as long as it's presented in the right way at a level that's developmentally appropriate to them, and we can help them with the strategy to get through whatever they need to get through. I feel passionate in my area about using working well with play specialists, because they are an absolute font of knowledge about connecting with children, putting them at ease, preparing them for procedures. So that will be one of my absolute top tips. Get to know your play specialists and listen to everything they tell you.
I imagine having your hair as well also helps put children at ease, because the first thing they see are all the amazing colours.
It seems to be working at the moment. But one little girl a couple of weeks ago told me that my hair looked like a unicorn's mane.
Oh, that's precious.
I know. I think that's one of the best compliments I've ever received.
Yeah. Oh, it's brilliant. And although you might not see them at this point, if there was a child who was scared of coming into hospital, what would you tell them?
I would try to encourage, you know, whoever they live with, whoever they trust, to think about how they could best prepare that child to come into hospital. So there are, various resources that people can use for children coming into hospital, various books and videos and things like that. Definitely it worth using those if it's a planned admission. Again, don't lie to children. Recognize that it's all right for them to be scared. That's a normal human emotion. And we have to find them a way to get through that. Big plea to parents and anyone else looking after kids: please don't ever use healthcare professionals as a threat. If you don't sit still, the nurse will give you a needle. That's not how we roll. So if we could get away from that, I'd be very grateful. Acknowledge their needs, their developmental stage, and let's try to prepare them, to make them ready to come into hospital in a way that is appropriate to them and their own individual needs.
Yeah, and I think especially what you said about don't lie to them, because once that's happened, the trust is gone.
Yeah.
You're back to square one of how do you then reassure the child when they know you've not told the truth in the past?
Yeah, exactly.
It's not a situation anyone wants to be in.
No, and that's important for our 5 and 6 year olds who are learning about the world and who they can trust and so on. It's also important for our young people and our young adults, knowing that they've got agency over their own health outcomes, and that they have a relationship with us separate to our relationship and their relationship with their parents and caregivers. So it's about us helping people to be independent young people and adults who are able to positively manage and influence their own health outcomes.
And what do you think is the most important thing that nursing has taught you?
Recognize that actually the most important thing about this is that people are humans. It's not about the fractured femur in 3 or the abdo pain in 7, which are things that I absolutely can't bear. It's all about human connection. And
the big question is, would you encourage other people to take up children's nursing?
100%. If you're going into it with the right philosophy, for the right reasons, and you recognise the challenges and the potential cost, and you still want to do it, 100%.
Thank you so much for watching our video. I've been Georgina with the Association of British Paediatric Nurses. If you enjoyed our video, please give us a like and subscribe to our YouTube channel. And if you have a question you'd like to ask a paediatric nurse, pop it in the comments below and we'll see if we can ask it in one of our videos. Bye!